Welcome back. Now, the state of healthcare in the Free State has worsened, and most community members, especially those suffering from HIV and TB, are discouraged from visiting clinics. Mary Nathi Ritshidze is the project officer at the Treatment Action Campaign. She joins us now in studio to tell us more. Exactly what do you mean in your statement when you say this? I mean, it means that people are opting to rather die than form part of those queues waiting for their medication.
Unfortunately, that is true because we come across a lot of people, I mean, one is too much, of people that would rather disengage from care because of reasons based on either the staff attitude that they receive from a facility or going to the facility more than once to be told that there's no treatment today or being given a very short supply, like 7 days of ARVs, and that is discouraging the patients from continuing with receiving the care.
And, you know, when it comes to those clinics, etc., when you go there yourself on the ground, how does it look to you, particularly in the Free State, and why just the Free State?
So we have community accountability meetings for different provinces, but yesterday we were launching the report for the Free State in particular.
Yeah.
So there's different issues that we find out from different provinces as we do the data collection. So when we go to facilities in the Free State, I need to highlight the fact that there are improvements that are being implemented based on the feedback that we provide to say, maybe at facility level, for an example, can the facility manager please intervene on certain issues within their powers? But also there's things that we escalate to the district or the province. So when we highlight issues of, for an example, infrastructural challenges, there are facilities where infrastructural challenges are being paid attention to. However, the other facilities are declining. So it basically is an imbalance now between what we highlight and what is being resolved, but having other facilities decline.
So tell me something, as a result of this, have patients, for instance, ended up dying because of a lack of treatment of ARVs?
Unfortunately, I cannot be specific about patients that have died because of the lack of availability of ARVs. Yeah. Those are cases that have not yet been brought to our attention or cases that we have not found out from the ground. But there are patients that die while waiting in the queue for services. When you ask, you find out that the nurse that was supposed to be working with children, the antenatal care, was on lunch. And the child ended up losing a life while in the queue, or an elderly person was in the queue for either their diabetes or hypertension medicine, and unfortunately did not receive assistance at the facility, and as soon as she got to her home, she collapsed at the gate and unfortunately lost her life. So I do not have anything that is specific about HIV, but we do have cases where people have lost their lives after not being attended to properly in facilities within the Free State province.
I'm just imagining those patients who say that they are opting not to take their ARVs because they don't want to be waiting in those queues, etc. Getting ARVs is also associated with a stigma because people still have a stigma you know, around people who have contracted that particular illness. So I imagine that their health obviously deteriorates because they're not taking the medication on a daily like they should. Have you had any conversation with the health department in that province, and also even national, because you say that you've been investigating all provinces?
Yes. So what happens is when we identify an individual who has disengaged from care for different reasons, usually it's because of the staff attitude. Sometimes it's because of one, if not all different types of staff members contributing to forced disclosure or disclosing for a patient while they're at the facility, being told publicly that you are not taking your ARVs, you are not adhering, so you will die. Meaning that everybody that is in the facility at that time has access to that information. So basically what happens is we immediately engage the facility. If we find a person right now, we immediately stop whatever it is that we were doing, focus on the individual, take them back to care, and in most instances, because these are facilities that we do have relationships with, people are put back to care. There's always two sides of the story, but we always focus on, yes, we were both wrong, but let's find a solution and ensuring that the patient stays in the care.
All right, so now tell me, in terms of all these solutions that you've been bringing up, etc., in your view, has South Africa's public health, which already was in tatters even before the COVID-19 pandemic, but now that we're sort of out of the woods, even with the 6th wave being warned in October, etc., would you say that our public health care has deteriorated even further now?
I would definitely say it has deteriorated, because when there's improvements, trust me, they're so minor that it is almost invisible. even if you want to highlight how the improvements are there, but it doesn't tally when you compare it to the deterioration. So I would safely say that the public healthcare system is actually deteriorating more than improving.
And I don't know what else you'd like to add. I mean, we have a government that wants to still implement a national health insurance
Yeah.
with, you know, what's happening at the moment with our public healthcare system. It was very badly tested during the 2 years when we had very bad COVID-19 cases. But just lastly, in terms of what happened last week, a lot of health institutions and organizations such as yourselves have been commenting about what we heard from former President Thabo Mbeki last week when it comes to HIV and his legacy, really, as a former ANC president and president of this country, when people were dying and we didn't have free ARVs. What's the treatment action campaign stance on the comments that the latest comments that he made about that tenure?
Yeah, so unfortunately I'm not in a position to comment for the treatment action campaign or on behalf of the treatment action campaign.
Yeah.
However, with
Ritshidze?
However, with the work that we have been doing and realizing, I think it is safe to say that we are very far from reaching the goal. There's times where you feel like you can see the light, but in as much as you're a person or an individual that understands the steps or the processes that are supposed to be put into place to ensure success of either the HIV or any other health-related services being improved and being proper and being good enough at a good standard for people or patients to be able to access them and be happy or be impressed with the services, it's a bit very far.
All right. Well, thank you very much for speaking to us here on eNCA. It was lovely to have you. That is, of course, she's from Ritshidze. They actually did, you know, a report basically talking about how devastating healthcare services are in the Free State province, to a point where even HIV patients are opting to stay at home than to form part of long queues at public institutions waiting for their ARVs to be administered to them.